Good day, my dear undergraduate exam going students, BDS and MBBS. Welcome to OTP, one time password for spotters. And this is class 5. On the screen, I am finding a eosinophilic material, which means connective tissue. And there is also another structure which is elongated and slightly curvilinear. At a higher magnification, I am able to make out that this is a blood vessel because the media I can see, the endothelium I can make out, and the RBCs. In the media, there is amorphous, basophilic, acellular material that is being deposited. All this give rise to a swan neck-like deformity or a rigidity of the blood vessel. This is yet another blood vessel showing that amorphous material. And the diagnosis is Monkeybugs medial sclerosis or medial calcification. Always calcium will be blue in color. Thick wall blood vessels, irregular basophilic material, basophilic blue area is acellular, and a swan neck-like rigid outline of the blood vessel. This is the next slide. Let us explain what is there in it. I am able to find out some kind of an epithelium. I do not know what it is at this magnification. But I can make out numerous small caliber blood vessels. These are also blood vessels. Why? Because I can see the RBCs at this magnification. And the intervening stroma showing multiple blue dots, which indicates nuclei, which means there is a lot of inflammation that is there. They are probably inflammatory cells. This should not be confused. That is, the slide should not be confused with a granuloma, usual mistake the students make, or a hemangioma, because I am seeing multiple blood vessels. Look at this slide. Here again, I am able to see the proliferation of the capillaries. Small caliber blood vessels, no media. Fibroblast and connective tissue. Fibroblast means, look at this one, they are all elongated cells that I can make out. Elongated cells of the fibroblast. And chronic inflammatory cells. Most of them are lymphocytes. Small dark blue dots. So the combination of all these three, capillaries, fibroblasts, and the inflammatory cells together give a diagnosis of a granulation tissue. The next one, courtesy ophthalmology review. This is a skin. I am able to find the epidermis, and this is the dermis lower down. But then the epidermis, it is showing some kind of a pattern, and there is also multiple cup-like depressions I can make out. In the superficial region of this lesion, I am able to see dark eosinophilic or pink structures. The diagnosis is molluscum contagiosum. What is said is, this is a bag of rice. When you invert the bag of rice, everything seems to be falling down. Similarly here, from the epidermis, there are the cells which are getting denuded and they fall off. So it has got an inverted bag of rice appearance. So what do I see? Skin with cup-shaped lobules. Look at this cup-shaped lobules. There are intracytoplasmic bodies. Within the cytoplasm, I find it. Superficially, they become more eosinophilic. It has got an inverted bag of rice appearance. The diagnosis is molluscum contagiosum. Please explain this. The next slide. So it is more of parasitology. There is a Tinea solium over here, and then it infects the man. And man is not a definite host, so you find that it is almost a dead end. And there will be the eggs of the parasite that are there lodged in the connective tissue and the muscle. It cannot develop any further, so it becomes a cyst. So this is called a cystic sarcosis. What are the points in favor of the diagnosis? There is a cyst that is embedded in a loose connective tissue. This surrounding one is a connective tissue, and this is the true cyst. The inner lining is chitinous. There are no cells that are seen in it. And the entire outline is somewhat leaf-like. My professor used to describe it as a polyleaf-like pattern. This is what I see. And the diagnosis is cysticercosis.